We go back now to one of the burning topics that we've been covering for you in recent days. As the country battles the third wave of COVID-19, dozens of medical interns have still not been placed for their mandatory internship at public health facilities. This has led to a degree of frustration among these doctors who feel that not enough is being done to address their plight. I'm joined now by Dr Mlungisi Phakathi, who is an unemployed doctor. A very good afternoon to you, Dr Phakathi. If you could update us on as to where you are now. There have been consultations that have been taking place with the Department of Health. Where are we regarding that? Dr Phakathi, I think you are muted. If you could unmute yourself, please.
Oh, my pardon. Sorry about that.
Thank you.
Good morning to you. Good afternoon to you and your viewers. As you might be aware that we've been in communication with the department since April. Lately, the last communication we received from the department was yesterday, if I'm not mistaken, when they told us that via our media, they told us that they are still busy with the consultations, trying to raise funds for the unfunded post. Then they said they will update us on the 30th of June. Mind you that our internship is to begin on the 1st of April. But then the last communication we received was that they are going to update us, not give us placements, but update us on the status, or on their status in placing us on the 30th. That was the latest update we received from the department via via media.
So what are the proper channels that actually ought to be used? Because surely hearing from the media is not necessarily an ideal way. Who should the department be actually talking to regarding your update and your situation?
I mean, when you are when we're applying in their website, they ask for our emails. They do have our emails, and then we do also call the ICSP. In most cases, when we do call, they usually do not have answers. The consultants that we usually get, but they do have our emails. The proper way to communicate is via emails. I think maybe I had some of us actually confirming that they did receive emails today, if not later yesterday. But then the official communication that we all received was via media.
So talk to us about the time span here. The department has said that by Wednesday you would have found out exactly what the update is, but this means that then you're supposed to be starting on the 1st. By the 1st, which is Thursday, all the placements were supposed to already have been scheduled. What impact does this timing have on you as unemployed doctors?
I should say first and foremost that this shows how the department is disorganized and careless when it comes to employing us as junior doctors, because the employment, the placement might take you anywhere in the country. I'm in Durban currently. I might maybe be offered a placement in Western Cape. So then one has to travel. It takes more so like a week to travel for some of us, for some even more. The department has disregarded all of that, and they just didn't show to care about all of that. Now, starting late will mean one is to finish late doing the internship, because there are regulations of the HPCSA that state how many hours are actually we are supposed to work as interns. So now if we continue losing days sitting at home like this and starting late, that means we will finish late. Or rather, the HPCSA doesn't give a go-ahead for us to start late, and we have to wait for the current rotation to finish, and the rotations are normally 3 months. They are 3 months, yes.
We are right in the middle of a pandemic, just have been upgraded to lockdown level 4. What impact do you believe the unemployed doctors can actually have in being part of the health solutions during this time?
I think the first thing will be to correct the misinformation that is being given around, that interns are just only there to be trained. Actually, we form part of the working force. Due to the shortage of doctors in other hospitals, interns end up running wards on their own and doing stuff with very less supervision. So we are as capable as some of our seniors, if I may say, in playing a role in fighting this pandemic. So I think the government is not doing right by our people by not employing us, because we play a huge role in the hospital setting.
What are the main reasons why the unemployed doctors have not been placed, as far as Department of Health is concerned, is that their budgetary constraints. They are currently now in consultation with National Treasury as well as the provincial health departments to try and solve this budgetary issue. But moving forward, how do you believe that the system and the planning needs to be adjusted to ensure that this is not a recurring problem, as we have seen it be in the past as well?
Well, there have been many suggestions. Some have suggested that maybe the government should allow also the private sector to provide internship to junior doctors, because it's only the public sector that provides this program to us. But I think there should be more accountability in the department, because right now what we are seeing is pointing fingers. The Department of Health will claim that, no, it's the Treasury, it's the provinces and so forth. They should take our health system very seriously, because we don't feel like we are being taken seriously. Because if you may allow me, those who are already employed, they are being overworked and so many things are happening. Some of them, it even impacts their psychological well-being, their mental well-being. So, and then it's a matter of taking things seriously and for government to be accountable when it comes to serious matters like this, especially now that we are facing this pandemic.
Dr. Mlungisi Phakathi, thank you for your time and updating us as to where the discussions are with the Department of Health, even though, as he's saying, that these discussions are mainly being updated through the media. Only some of them haven't received those direct emails. But come Wednesday, that is when the department says they will have all the information as to what the status quo is regarding the funding for the placements. We'll be bringing